Your kidney health could be at risk without you even being aware of it. Today, I will reveal 9 alarming signs that indicate your kidneys are crying out for help. I will also share 8 essential methods to protect them and prevent kidney disease from developing. Many people wonder whether it is truly possible to avoid kidney problems altogether. The answer is encouraging, as in the majority of cases, yes, you can prevent kidney damage. Let me explain why your kidneys are so crucial for your overall health and well-being. These bean-shaped organs perform vital functions that keep your body functioning optimally each day. Let us begin by understanding what it means to have weak kidneys or kidney failure. From a medical perspective, weak kidneys mean they can no longer filter blood properly as they should. Your kidneys perform numerous vital functions, primarily blood filtration, which is essential for life. They also produce important hormones like erythropoietin, which is crucial for red blood cell production and bone health. Your kidneys regulate the balance of essential minerals such as magnesium, phosphorus, and the activation of vitamin D. Without properly functioning kidneys, these vital processes become compromised, affecting your entire body. The kidneys work tirelessly 24 hours a day to filter waste products from your bloodstream. They process approximately 150 quarts of blood daily to produce about 1 to 2 quarts of urine. This incredible filtering system helps maintain the delicate balance of chemicals and water in your body. Now let us examine the 9 signs that should alert you to potential kidney health issues. The first sign is swelling, particularly noticeable in the legs, feet, and lower limbs where it often begins. This fluid accumulation can also occur elsewhere in the body, such as in the lungs, causing serious complications. Kidney problems can lead to pulmonary edema, a potentially life-threatening condition that requires immediate medical attention. Fluid can accumulate in other areas like the face, but the legs and feet are typically the first affected regions. If you notice unusual swelling in your lower extremities, it would be wise to have your kidney function checked. Other conditions like liver or heart disease may cause similar symptoms, but kidney problems are often the underlying cause of such swelling. The body's inability to remove excess fluid is a direct result of declining kidney function and filtration capacity. I want to remind you that this information could literally save your life or the life of someone you care about. Please consider subscribing to our channel and activating the notification bell to stay informed about essential health advice. Where are you watching this video from today? Share your city in the comments below. I love connecting with viewers worldwide. The second sign encompasses shortness of breath, fatigue, and a general decrease in energy levels throughout your day. These symptoms appear because kidney diseases can cause anemia, leading to reduced oxygen delivery to your tissues and muscles. As mentioned previously, your kidneys play a crucial role in red blood cell production by stimulating your bone marrow. Symptoms such as paleness, breathlessness during normal activities, and constant fatigue warrant a thorough check of your kidney function. Many people mistakenly attribute these symptoms to aging or stress, missing the opportunity for early intervention. When your kidneys cannot properly stimulate red blood cell production, your entire body suffers from reduced oxygen supply. The third sign is involuntary weight loss, a symptom that often causes concern among patients and healthcare providers alike. Kidney diseases can alter your appetite and taste perception, making you less inclined to eat your normal diet. This decreased appetite naturally leads to weight loss that should alert you to potential underlying kidney issues. Unexpected weight loss of more than 5% of your body weight within 6 months without trying should never be ignored. The accumulation of waste products in your body due to poor kidney function can also contribute to this weight loss. The toxins that build up can make food taste different or metallic, further reducing your desire to eat properly. The fourth sign is high blood pressure that is difficult to control despite medication and lifestyle modifications. If you take multiple medications to manage your blood pressure, or if you are young, active, and otherwise healthy but still suffer from hypertension, this could indicate a kidney problem. A sudden increase in your blood pressure without any apparent change in your lifestyle represents a red flag for possible kidney issues. Your kidneys play an important role in regulating blood pressure, and their dysfunction can manifest as treatment-resistant hypertension. This creates a dangerous cycle, as high blood pressure can damage kidneys, and damaged kidneys can cause high blood pressure. Regular monitoring of your blood pressure is essential, especially if you have a family history of kidney disease. Many people are unaware that kidneys and blood pressure are intimately connected through the renin-angiotensin-aldosterone system. The fifth sign is a feeling of coldness, particularly in the hands and feet, that seems unusual for you. It is important to note a change from your normal state, not simply when you find yourself in a cold environment. If you did not typically feel cold in your extremities before but now experience this regularly, it could indicate anemia related to kidney problems. This unusual sensation is due to a decrease in red blood cells as explained earlier in our discussion about kidney functions. Poor circulation resulting from anemia means less warmth reaches your extremities, leaving them feeling unusually cold. Many people dismiss this symptom, attributing it to poor circulation or aging rather than considering kidney function. The sixth sign is waking up to urinate multiple times during the night, disrupting your sleep patterns. When your kidneys are not functioning correctly, you may experience fluid retention during the day as water is not properly filtered. In a lying position, pressure causes increased filtration by your kidneys, particularly at night when your body is horizontal. If you wake up 3 or 4 times to urinate, it would be prudent to have your kidney function evaluated by a healthcare professional. Diabetes can also cause this symptom, but kidney problems should be considered as a potential cause of nocturia. Many people accept frequent nighttime urination as a normal part of aging, missing this important warning sign. The seventh sign is skin itching that may seem unexplained or persistent despite using moisturizers or anti-itch creams. Your kidneys filter blood and eliminate toxins, and if they cannot properly perform this task, urea levels may rise in your bloodstream. Excess toxins can harm your body and cause itching similar to that observed in liver problems or other systemic conditions. The buildup of waste products in your body can crystallize on the skin, causing intense itching that is difficult to relieve. This itching is often more generalized rather than localized and may worsen at night, affecting your quality of sleep. Many patients report this symptom long before other more recognized signs of kidney disease become apparent. The eighth sign, quite peculiar but significant, is a metallic taste in your mouth that persists without explanation. If you feel as though you have metal in your mouth for no apparent reason, this could be related to the accumulation of substances that your kidneys should normally filter out. An evaluation of your kidney function would then be necessary to rule out any serious problem affecting your renal health. This taste disorder, known medically as dysgeusia, results from uremic toxins building up in the bloodstream and saliva. Many patients describe this as tasting iron or copper, or having a constant unpleasant taste that affects their enjoyment of food. This symptom can contribute to poor nutrition as it makes eating less pleasurable, creating a cycle that further impacts health. The ninth and final sign concerns changes in your urine, but not necessarily in its volume as many might expect. Contrary to popular belief, urinating too little or too much can signal kidney disease, but this is not always the case with early kidney dysfunction. Often, weakened kidneys function poorly but urine appears normal in appearance and quantity to the casual observer. I would like to highlight a particular change called foamy urine, when you urinate and the foam persists in the toilet bowl. This can indicate the presence of proteins in the urine, specifically albumin, which causes this foam and requires medical evaluation. Healthy kidneys should keep protein in your bloodstream, so its presence in urine suggests that the kidney filters are damaged. Changes in urine color can also occur, ranging from very pale to dark amber, depending on your hydration status and kidney function. Some patients may notice blood in their urine, either visible to the naked eye or detectable only through laboratory testing. Now that we have identified the warning signs, let us explore how to care for your kidneys and protect their function. Here are 8 essential tips to prevent kidney disease and maintain optimal kidney health throughout your lifetime. The first tip is proper hydration, and I suggest drinking 6 to 8 medium-sized glasses of water each day. I have chosen to speak in terms of glasses rather than milliliters because many find it difficult to evaluate quantities in measurement units. Water helps your kidneys filter waste products efficiently and helps prevent kidney stone formation in susceptible individuals. Adequate hydration also helps prevent urinary tract infections, which can ascend to the kidneys if left untreated. However, some kidney conditions require fluid restriction, so always follow your doctor's specific recommendations regarding fluid intake. The color of your urine can serve as a good indicator of your hydration status. with pale yellow generally indicating adequate hydration. The second way to care for your kidneys is to undergo routine tests such as creatinine measurement and estimated glomerular filtration rate. These tests evaluate kidney function and allow doctors to estimate what percentage of kidney function you currently have. Generally, the upper limit for creatinine is 1.2 for men, which can go up to 1.4 in some cases. It is important to note that for physically active people with more muscle mass, higher creatinine does not always indicate disease. That is why it is crucial to regularly calculate and monitor kidney function through comprehensive testing protocols. Other tests are useful, but I will emphasize the importance of the simple urine test, sometimes called partial urinalysis. This test can detect blood in the urine before it becomes visible to the naked eye, an early warning sign of kidney damage. It is also crucial for detecting proteins before foamy urine becomes apparent, as mentioned in our discussion of warning signs. Checking glucose levels is also important as traces in urine can indicate high blood sugar, which can damage kidneys over time. Other tests such as urea, sodium, potassium, magnesium, and phosphorus levels may be necessary, but the two I mentioned are crucial. Imaging tests such as kidney ultrasound are not routine but may be prescribed if signs or symptoms appear that warrant further investigation. These imaging studies help assess kidney size, shape, and structure, providing valuable information about potential abnormalities. The third piece of advice is to be very careful with medications, particularly self-medication, which is becoming increasingly common. I want to highlight one class of drugs, anti-inflammatory medications such as naproxen, diclofenac, nimesulide, and ibuprofen. These medications can damage the kidneys if taken without proper control or medical supervision for extended periods. Studies have shown that these drugs can reduce kidney filtration and cause blood filtration problems in susceptible individuals. Surprisingly, just 5 days of uncontrolled use can harm your kidneys, a fact that many people are completely unaware of. Always consult with your healthcare provider before taking any medication regularly, especially if you have risk factors for kidney disease. Over-the-counter pain relievers, while easily accessible, should be used cautiously and according to package directions. Some prescription medications can also affect kidney function, which is why regular monitoring is essential during treatment. The fourth tip for preventing kidney disease is to manage your blood pressure effectively through lifestyle and medical interventions. High blood pressure can damage your kidneys because it can negatively affect various organs, including the delicate filtering units in your kidneys. It is crucial to be vigilant regarding your consumption of salt and sodium, with recommendations not exceeding 5 grams of salt or 2 grams of sodium per day. Most studies show that in many countries, people consume more than double the recommended amount of sodium in their daily diet. Excessive salt consumption over the long term can lead to various health problems, notably an increase in blood pressure. Many processed foods contain hidden sodium, so reading nutrition labels carefully can help you monitor your intake. Regular blood pressure checks and maintaining blood pressure below 140/90 can help protect your kidneys. Lifestyle modifications such as reducing stress and maintaining a healthy weight also contribute to better blood pressure control. The fifth tip for protecting your kidneys is to adopt a diet rich in fiber, vegetables, and fruits while limiting processed foods. Processed foods typically contain more preservatives and sodium than fresh, whole foods prepared at home with minimal processing. You will easily exceed the recommended sodium limit if you regularly consume ultra-processed foods as a significant part of your diet. A diet rich in fiber helps prevent various conditions, including kidney problems, by promoting overall digestive and cardiovascular health. Foods particularly beneficial for kidney health include berries, fish rich in omega-3 fatty acids, and leafy green vegetables. Some studies suggest that a Mediterranean-style diet may be protective against chronic kidney disease and its progression. Limiting animal protein intake can also help reduce the workload on your kidneys, particularly if you already have reduced kidney function. Working with a registered dietitian can help you develop an eating plan tailored to your specific kidney health needs. The sixth tip is to control your blood sugar levels, as diabetes is a major risk factor for kidney disease worldwide. In some countries, diabetes has surpassed hypertension as the leading cause of end-stage kidney disease requiring dialysis or transplantation. Elevated blood sugar levels can damage not only the kidneys but also the heart, eyes, and nerves throughout your body. Maintaining glycemic control through diet, exercise, and medication when necessary can significantly reduce your risk of diabetic kidney disease. Regular screening for early signs of kidney damage is essential for people with diabetes, as early intervention can slow progression. The relationship between diabetes and kidney disease is so strong that the term diabetic nephropathy was created to describe this specific condition. Managing diabetes effectively is one of the most powerful ways to protect your kidneys from progressive damage over time. The seventh way to protect your kidneys is through regular physical activity, at least 150 minutes of exercise per week. Distribute this activity into 3 sessions or more and choose the exercise that you enjoy most and have consistent access to. Studies show that a sedentary lifestyle constitutes a risk factor for kidney disease and many other chronic health conditions. Exercise helps control blood pressure and blood sugar levels, 2 major risk factors for kidney disease as we have discussed. Physical activity also helps maintain a healthy weight, reducing the strain on your kidneys and cardiovascular system. Even moderate exercise such as brisk walking can provide significant benefits for your overall health and kidney function. Start slowly if you have been inactive and gradually increase your activity level under appropriate medical supervision. Regular exercise also improves circulation, helping your kidneys receive the blood flow they need to function optimally. The 8th and final piece of advice is not to hold your urine for prolonged periods, a habit that many develop due to busy schedules. This habit can lead to urinary tract infections, and repeated infections can damage your kidneys over time if left untreated. When you feel the urge to urinate, try to find a bathroom within a reasonable time frame rather than consistently delaying. Urinary stasis provides an environment where bacteria can multiply, increasing your risk of infection that could affect your kidneys. Women are particularly susceptible to urinary tract infections and should be especially mindful of this recommendation. Proper hygiene practices also help prevent urinary tract infections that could potentially ascend to the kidneys. Drinking adequate fluids throughout the day helps ensure regular urination and flushes bacteria from your urinary tract. Emptying your bladder completely when you urinate also helps prevent infection and kidney damage over time. Taking care of your kidneys is essential for your overall health and quality of life as you age. By being attentive to warning signs and following these 8 prevention tips, you can maintain healthy kidney function. Early detection of kidney problems allows for interventions that can slow or prevent progression to kidney failure. Regular checkups with your healthcare provider should include assessment of kidney function, especially if you have risk factors. Many kidney diseases progress silently without symptoms until significant damage has occurred, making prevention crucial. Your kidneys work hard for you every moment of every day, filtering waste and maintaining the balance your body needs. Giving them the care and attention they deserve through healthy lifestyle choices is an investment in your long-term well-being. Remember that kidney disease is often preventable through the strategies we have discussed throughout this presentation. Taking proactive steps today can help ensure your kidneys continue to function optimally for years to come. Understanding the risk factors and warning signs empowers you to take control of your kidney health proactively. With proper care and attention, most people can maintain healthy kidney function throughout their lifetime. Do not wait for symptoms to appear before beginning to care for these vital organs that do so much for your health.